Edutainment Studios welcomes you to Autism Spectrum Disorder, Beginning to Understand. This module is part 2 of a 9-part series. Autism is not just a single disorder, but is actually a spectrum of closely related disorders that have a shared core of symptoms. Every individual on the autism spectrum has some degree of difficulty with social interaction, empathy, communication, and flexible behavior. However, the level of disability and the combination of symptoms varies tremendously from person to person. In this course, the objective is to help you learn the symptoms of autism spectrum disorder. Each individual with ASD has a different set of communication skills. While some can speak very well, others can only speak very little or not at all. Some don't begin to speak until later in their childhood. Those who do speak might not be able to express their words into full sentences. Some with ASD can only articulate one word at a time, while others repeat the same words or phrases over and over. Some children just repeat what others say, which is a condition called echolalia. Although some children without ASD go through stages where they repeat what they hear, it normally passes by the age of 3. Some people who can speak well may have a hard time listening to what other people are saying. A portion of these individuals have a hard time using and understanding hand gestures, body language, or tone of voice. Their facial expressions, movements, and gestures may not match what they are saying. For instance, they might smile while they are saying something sad. People with ASD might say "I" when they mean "you," or vice versa. Their voices might sound flat and robotic, or high-pitched. They might stand too close to the person they are talking to, or stick to one topic of conversation for a long time. They might have one-sided conversations where they talk a lot about something they really like, rather than a back-and-forth conversation allowing someone else to speak. Some children with fairly good language skills will speak like little adults, failing to pick up on the kid speak that is common among other children. Someone with autism spectrum disorder may show limited, repetitive patterns of behavior, interests, or activities. Signs of this can include performing repetitive movements such as rocking, spinning, or hand flapping, acting out activities that could cause self-harm such as biting or headbanging. You may develop specific routines or rituals and become disturbed with the slightest change. You may have problems coordinating movements or moving in odd patterns. This involves clumsiness, walking on toes, and stiff or exaggerated body language. Fascination with details of an object, such as the spinning wheels of a toy car, but not understanding the overall purpose or function of the object is yet another aspect. You may have sensitivity to light, sound, or touch, yet may be indifferent to pain or temperature. You may not engage in imitative or make-believe play. Many fixate on an object or activity with abnormal intensity or focus. And you may develop specific food preferences, such as eating only a few different kinds of foods or refusing to eat food with a certain texture. Repetitive motions can involve one part of the body, the entire body, or even an object or toy. For example, people with an ASD might spend a lot of time repeatedly flapping their arms up and down or rocking from side to side. They might repeatedly turn a light on and off or spin the wheels of a toy car. These types of activities are known as self-stimulation or stimming. People with ASD often thrive on a routine in order to function day by day. Any change in the normal pattern of their day can be very upsetting. They may lose control and have a meltdown or tantrum, especially if they are in a new and strange place. Other symptoms of ASD might include hyperactivity, impulsivity, short attention span, aggression, unusual eating and sleeping habits, unusual mood or emotional reactions, unusual reactions to the way things sound, smell, taste, look, or feel. Diet may be limited to only a few different kinds of foods, while others might eat non-food items like dirt or rocks. This behavior is called pica. They could also have issues like chronic constipation or diarrhea. They have a tendency to have odd sleeping habits and may also have abnormal moods or emotional reactions. In addition, they might not be afraid of dangerous things, but fearful of harmless objects or events. There are currently no medical tests that can diagnose autism. However, there are specially trained physicians and psychologists who can administer behavioral evaluations if there is a suspicion of autism. Signs of ASD often appear early in childhood development when there are obvious delays in language skills and social interactions. The doctor may recommend developmental testing to identify if a child has delays in cognitive, language, or social skills. Some signs that would warrant this testing would be if a child does not respond with a smile or happy expression by 6 months, mimic sounds or facial expressions by 9 months, babble or coo by 12 months, make gestures such as point or wave by 14 months, speak single words by 16 months, play pretend by 18 months, say two-word phrases by 24 months, or if they lose language or social skills at any age. If you are concerned about your child's development or suspect that they may have autism spectrum disorder, make sure to discuss your concerns with the doctor. The symptoms associated with this disorder can also be linked to other developmental disorders, so there is no harm in having your child tested. Sometimes ASD is diagnosed later in life, often in relation to learning, social, or emotional difficulties. As with young children, diagnosis of adolescents and adults involves personal observation and an interview with a trained specialist. A proper diagnosis can bring relief to those who have long struggled with relating socially while not understanding the source of their difficulties. A diagnosis can also give access to therapies and assistive technologies that can improve function in problem areas and thus improve the overall quality of life. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 2 of 9 on Autism Spectrum Disorder, and please join us for Part 3.